Yes, good evening, Ash, Harsh, Chirag, Jainam, Afzal. Good evening, beta. Good evening. So today we are going to discuss about the galactose and fructose metabolism. Already we know the carbohydrates gets digested to form glucose, galactose and fructose. About glucose beta we have already discussed in detail. About glucose, all the pathways, aerobic glycolysis, anaerobic glycolysis, okay, gluconeogenesis, glycogen metabolism, glycogenesis and glycogenolysis, HMP pathway, TCA cycle or Krebs cycle. I have already discussed it. Chandru, good evening beta. Welcome to the session on galactose and fructose metabolism. So before starting with the session, just give me a thumbs up in the chat box beta if the audio and visuals are perfectly fine, so that we can begin with the session. So yes, let me know if the audio and visuals are perfectly fine so that I can start with the session. Perfect, perfect beta. Yes, Harsh, okay beta. What about rest? Chirag, very good beta. Very good. Yeah, yup. Rest. I please try to comment in the chat box. Yeah, I hope everything is fine at my end, and I'm hoping for the same that everything is like fine at your end also. Sure. Let us start with the galactose metabolism. First thing that I will be discussing about the galactose metabolism. And remember, these are like very short cycles, I would say. The galactose metabolism. Galactose metabolism. Usman, good evening. Good evening, beta. Welcome to the session. Yes, I'm very much fine. Let us start with the galactose metabolism. So you already know. Yeah. Okay. My first question to everyone over here, that galactose, okay, it is a digested product of which disaccharide? Okay, it is a digested product of which disaccharide? I want everyone to answer this question in the chat box. So you already know. Let us just start with the galactose part. You already know the galactose. Okay, I'm just showing the reaction over here. Beta, what happens? The galactose will convert. Okay, shit. Yeah, the galactose will convert into galactose 1 phosphate. Okay, it will convert into galactose 1 phosphate. Now, I want to ask everyone, what is the enzyme that will be used over here? What is the enzyme that will be used over here and which molecule will be used over here? Yes, Surbeen Kaur, very good beta. That was lactose, very good beta. It was the lactose, okay, that digest that is getting digested to form the glucose and the galactose. Yeah. So you guys are going to tell me which enzyme will be used over here. Peter, you already know galactose, okay? Fructose, glucose, galactose, they all are having 6 carbons, right? They all are having 6 carbons. And galactose 1 phosphate will be having the phosphate group at first carbon. Will be having the phosphate group at the first carbon, right? That is why the name it is galactose 1 phosphate. Yes, very good. Jainam, Chirag, Harsh, Chandru, very good, beta. You already know it is kinase, and since it is galactose, so the name over here will be galactokinase. The name over here will be galactokinase. Okay, the name over here will be galactokinase, and yes, this phosphate will be coming from which molecule, guys? This phosphate will be coming from which molecule? I want everyone to answer this question. The phosphate will be coming from which molecule? Yes. चलो फटाफट से आंसर दो. Phosphate will be coming from which molecule बेटा? चलो जल्दी से आंसर दे दो. यस, एटीपी. वेरी गुड चिराग, वेरी गुड बेटा. तुमने कंसेप्ट समझे हुए हैं. अब देखो तुम्हारी ये चीजें कितनी इजी हो जाती है. यू ऑलरेडी नो. Yes, it is ATP which will be converting into ADP, and it requires the influx of magnesium ions. Right, very good, very good. Janam, very good. Harsh. So you already know we have got galactose 1 phosphate. Yes, Chandru, very good. Ash, very good, very good. Now this galactose 1 phosphate, okay, will change. Okay, this galactose 1 phosphate, yes, this galactose 1 phosphate will change into glucose 1 phosphate. Okay, it will change into glucose 1 phosphate. Now it will change into glucose 1 phosphate. Now you already know we have something that is called as UDP glucose. Okay, we have UDP glucose. Now you already know we have UDP. UDP की full form क्या है? जल्दी से बताओ, what is the full form of UDP? Uridine diphosphate. हमने पढ़ा था, yes, uridine diphosphate, right? So we have UDP glucose. Okay, now UDP glucose. Okay, what will happen, beta? What will happen? This UDP glucose. Okay, what will happen? Now this galactose will come with UDP, and this glucose will go with phosphate. This glucose will go with phosphate, right? Now what will happen, beta? This will become UDP galactose. Okay, this will become UDP galactose. अब UDP के साथ galactose जोड़ गया, glucose is free. So the product over here, beta, it is glucose 1 phosphate. The product over here will be glucose 1 phosphate. And the enzyme, beta, that is used over here, it is uridyl transferase. देखो ट्रांसफर कर रहे हैं ना एक मॉलिक्यूल को दूसरी जगह पे, इट इज यूरिडिल ट्रांसफरेस. इट इज यूरिडिल ट्रांसफरेस बेटा, इट इज यूरिडिल ट्रांसफरेस, राइट? नाउ okay, so yes, along with that, beta, remember it is a reversible reaction. Okay, this UDP glucose galactose can also convert into UDP glucose by the help of enzyme epimerase. By the help of enzyme epimerase. Yes, very good, Chandru. Very good. It is the uridine diphosphate. Very good, beta. UDP galactose can also convert to UDP glucose. Okay, and that is by the enzyme. Okay, epimerase. Now, glucose 1 phosphate. Now, glucose 1 phosphate will further undergo two processes, beta. Either it can go to glycolysis, or it can also go to glycogenesis. Okay, glycogenesis. And these two processes I have already told you. Okay, glucose 1 phosphate will be converted to glucose 6 phosphate, and you already know glucose 6 phosphate will enter glycolysis. Glycogenesis also I have already told you how the glucose 1 phosphate is utilized to form the glycogen, right? We have discussed glycolysis and glycogenesis in detail, guys, in detail. So you are very much aware, that we are starting with galactose and ultimately we are landing up in glycolysis or glycogenesis. Yes, we are landing up in. मेरा अभी क्लासेस वगैरह मैं सारी बताऊंगा, इसके बाद एंजाइम्स का टॉपिक ही है कल चंद्रू, हम लोग पूरा डिटेल में डिस्कस करेंगे एंजाइम्स. नो नीड टू वरी अबाउट इट राइट नाउ, जस्ट राइट इट ओवर हियर. कल पूरा एंजाइम्स डिटेल में पढ़ाऊंगा, ठीक है? Now beta, what you have to remember over here, that there can be, okay, there can be, yes, deficiency of this enzyme uridyl transferase, or it is better known as, or the full form, beta, you can write it, it is galactose, or yes, yeah, it is galactose 1 phosphate uridyl transferase. गैलेक्टोज 1 फॉस्फेट यूरिडाइल ट्रांसफरेज, इसका पूरा नाम यही होगा क्योंकि इसका जो सबस्ट्रेट है इट इज गैलेक्टोज 1 फॉस्फेट. इट इज गैलेक्टोज 1 फॉस्फेट. नाउ देयर आर टू कंडीशंस, बेटा. I hope this is clear to everyone. Just give me a thumbs up in the chat box, beta, if it is clear to everyone. Yeah, just give me a thumbs up in the chat box if it is clear to everyone. Yes, Harsh, very good, beta. Very good. चलो बाकी सब, जयनाम, very good, beta. Very good. Sure, very good. Yes, doctor. Okay. Surveen, Riya, Usman, Ash, Chirag, Jainam, very good. चलो बेटा, अब फटाफट से इसमें दो चीजें देखनी है हम लोगों को. we have to discuss the disorders of galactose metabolism. Okay? We have to discuss disorders of galactose metabolism. Disorders of galactose metabolism. The very first thing, the very first thing that we have to know beta over here, it is galactokinase deficiency. It is galactokinase deficiency. Okay. And the second one, it is the classical galactosemia. It is the classical galactosemia. Okay, classical galactosemia. Yes, everyone is right. Surbeen, right? Chandru, very good. I will be discussing galactokinase deficiency also. Okay. Now, if I say, okay, there are certain parameters on which we will study the differences first. Then I will discuss about the classical galactosemia in detail. Okay. First, let us try to differentiate. Okay, let us try to differentiate on certain points. Galactokinase deficiency. Okay, it is simply the enzyme which will be deficient over here. It will be galactokinase. It will be galactokinase. And the enzyme which is deficient in classical galactosemia, the enzyme which is deficient in, yes, classical galactosemia, it is, remember beta, it is galactose. We have just mentioned beta, it is galactose 1 phosphate uridyl transferase. Uridyl transferase. Uridyl transferase. So we have just mentioned this enzyme over here. We have just mentioned this enzyme over here. Yes. Yeah. So galactose 1 phosphate uridyl transferase, and we have galactokinase. We have galactokinase. So we have two conditions over here. One where we have the deficiency of galactokinase. So simply it is called as the galactokinase deficiency. The other one, it is the classical galactosemia, where galactose 1 phosphate uridyl transferase, it is deficient, right? The enzyme deficiency. Yes, we have discussed the enzyme deficiency over here. So it is the enzyme deficiency. Enzyme deficiency. Okay. Now, now what will happen, beta? What will happen? You already know what is the pathophysiology related to it. What is the pathophysiology? Okay. What is the pathophysiology related to it? Now, beta, remember over here, if galactokinase is deficient, what will happen? This galactose will be, okay, will be reduced to form galactitol. Okay, it will be reduced to form galactitol with the help of enzyme aldol reductase. With the help of enzyme aldol reductase. With the help of enzyme aldol reductase. Okay. Now, if galactokinase is deficient, obviously बात है galactose 1 phosphate नहीं बना सकता. क्यों नहीं बना सकता? Because galactokinase is deficient. Now this galactose will be reduced with the help of enzyme aldol reductase, and it will form galactitol. Okay, galactitol. So pathophysiology beta, remember over here what will happen? Yes, over here what will happen? Galactitol will accumulate. Okay, galactitol will accumulate, right? Galactitol will accumulate if the diet has galactose. If diet has galactose. Now, yes. Is it understood to everyone? Just give me a thumbs up in the chat box. Yes. हाँ चंद्रू, ठीक है बेटा, वो बाकी सब बता दो. इतना समझ में आया कि galactitol will accumulate, right? Yes. Hmm. Hmm. Chal, Harsh, Jainam, Ash, very good. Yes, Surbeen, very good. Now, beta, use your brains and tell. I want everyone to answer. If this enzyme is deficient, now blood, what किस चीज का level बढ़ जाएगा body में? Okay, increased amounts of which substrate will be there? राइट इन द चैट बॉक्स। चलो थोड़ा सा ब्रेन यूज करो। अगर ये एंजाइम डेफिशिएंट है तो गैलेक्टोज 1 phosphate will not be able to convert into glucose 1 phosphate. Now what will accumulate? Which higher concentrations of what will be seen? Which molecules? Yes, Jainam, very good beta. It is the galactose 1 phosphate. Obviously बात है ना कि अगर galactose 1 phosphate uridyl transferase will be deficient, what will happen? What will happen? There will be accumulation of galactose 1 phosphate. Okay, okay. So you already know the galactose 1 phosphate. Galactose 1 phosphate. Okay, will increase. Okay, will increase. Yes, will increase. Now remember beta, now this galactose 1 phosphate, it is allosteric inhibitor. Okay, it is allosteric inhibitor. Yes, everyone is right. Usman Chandru, very good. It is allosteric inhibitor of glycogen phosphorylase. Glycogen phosphorylase. Now you guys already know glycogen phosphorylase. It is an important enzyme in glycogenolysis, right? In glycogenolysis. So what will happen? This galactose 1 phosphate will inhibit this enzyme. It will inhibit this enzyme. Now, if this enzyme is inhibited, now what will happen? It will lead to decreased glycogenolysis. It will lead to decreased glycogenolysis. Now, if glycogenolysis is decreased, what now the patient will be suffering from what? Tell me in the chat box. अगर glycogenolysis नहीं होगा तो क्या नहीं मिलेगा? What we will not get, बेटा? Tell me in the chat box what we will not get. If the glycogenolysis is decreased, what is the thing that we will not get? चलो आंसर बताइए जल्दी से चैट बॉक्स में। ग्लूकोज नहीं मिलेगा, ग्लूकोज नहीं मिलेगा। वेरी गुड चिराग। ऑब्वियसली बात है, ग्लाइकोजेनोलाइसिस, ग्लाइकोजन का टूटना। अगर ग्लाइकोजन नहीं टूटेगा, ग्लाइकोजन टूटता है तो क्या बनता है? ग्लूकोज। इफ द ग्लाइकोजन विल नॉट ब्रेक, okay, then what I will not get? Glucose, 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 glucose. Very good, everyone is right. Harsh, Jainam, Riya, very good. So the patient will be suffering from fasting hypoglycemia. फास्टिंग हाइपोग्लाइसीमिया। मैंने पहले भी बताया था कि ग्लाइकोजेनोलाइसिस जो है, इट इज टेकिंग प्लेस इन द फास्टिंग स्टेट। इट इज टेकिंग प्लेस इन द फास्टिंग स्टेट, क्योंकि फास्टिंग के टाइम पे ही क्या होता है कि बॉडी को ग्लूकोज की जरूरत है। जिस टाइम यू आर नॉट टेकिंग द फूड, अर्ली फास्टिंग 4 to 16 आवर्स, ओके, तब ग्लूकोज ब्रेक डाउन करता है, एनर्जी मिलती है। बट इस केस में ग्लूकोज विल नॉट ब्रेक डाउन, सो द पेशेंट इज मोर लाइकली टू सफर फ्रॉम फास्टिंग hypoglycemia. Fasting hypoglycemia, right? So yes, now if we talk about the presentation beta, presentation, if we talk about the presentation beta, you guys already know that it is a relatively mild condition. Okay, this is relatively mild condition. Okay, now apart from that, it is yeah, what will happen? The galactose, okay, will appear in blood. Okay, the galactose will appear in blood, and this is something which is called as galactosemia. It is something which is called as galactosemia. And beta, remember this galactosemia, it is non-classic galactosemia. Okay, remember it is non-classic galactosemia. Okay, yes, non-classic galactosemia. And remember beta, the galactose, it will also appear in urine. Okay, it will also appear in urine, and it will lead to galactosuria. Okay, galactosuria, right? And yes, yes, and it will also lead to infantile cataracts. I have already told you, if it is reduced beta. Okay, if it is reduced, yes, I will come to this cataract point in detail when I will be explaining about the sorbitol also. Yes, we actually need an enzyme to know for the breakdown of this. But if that enzyme is absent, beta, now what will happen? This will again, yes, this will accumulate, yeah, and it can again lead to this, right? So I hope it's clear to everyone over here. Presentation of this galactokinase deficiency. Yes, I hope it's clear. Hmm. चलो जयनाम रिया वेरी गुड. जयनाम रिया वेरी गुड. Classical galactosemia ka presentation I'm discussing on the next page. Okay, I am discussing about the classical galactosemia and I will be discussing the presentation over here. Classical galactosemia. What is the presentation over here, beta? Presentation. Now, usually it occurs age onset that you have to remember, beta. The age onset, it is 1 to 2 weeks of life. 1 to 2 weeks of life. Okay. Now, when the infant basically it is less than 1 years, right? Infant it is fed, okay, on breast milk पर उसको अगर फीडिंग करोगे तो ब्रेस्ट मिल्क में क्या प्रेजेंट होता है? लैक्टोस. और लैक्टोस ब्रेक करेगा तो क्या बनेगा? गैलेक्टोस प्लस ग्लूकोस. गैलेक्टोस प्लस ग्लूकोस. Okay, so yes. Now this galactose is not getting digested. This galactose, it is not getting digested. What will happen now? Now this person, okay, so what will happen? Failure to thrive, भुखमरी हो जाएगी बिल्कुल. Failure to thrive, ग्रो नहीं करेगा बच्चा. वॉमिटिंग देखने को मिलेगी उस बच्चे में. वॉमिटिंग विल बी सीन. Okay, there will be feeding difficulties which will be there, right? Okay, there will be seizures also. Okay, seizures होंगे और seizures की वजह से फिर कोमा में भी जा सकता है. Okay, apart from that, the बच्चा क्योंकि it is not getting proper food, it will be mentally retarded. Okay, देखो mentally retarded होगा बच्चा, right? दूसरी बात, इसमें तुम्हें हिपैटोमेगाली देखने को मिलेगी because the galactose will be accumulated. Hepatomegaly, yes. Apart from that, you will see, yeah, liver failure due to jaundice. Liver failure, okay, and that is due to the jaundice part. That is due to the jaundice part, right? Now you already know. Yes. So apart from that, beta, you will also see infantile cataracts. That is common to this also. Infantile cataracts, and you already know, beta, this is calcitol which will accumulate in the islands. Accumulate in islands, right? In islands. So yes, that will be not see, you already know the galactose 1 phosphate will not be able to convert into glucose 1 phosphate, so it will be reduced, it will form galactitol, and these calcitol will be like accumulated in the islands. And yes, हाँ, mental retardation मैंने लिखा हुआ है बेटा. New term for mental retardation, I think Chandru has very good, nicely mentioned. It is intellectual disability. It is intellectual disability, beta. Nowadays we are using intellectual disability for this, right? So yes, yes. So now see how the question will come. Now the question will come like this. The boy presented with vomiting, it presented with jaundice, failure to thrive as soon as breastfeeding initiated. Now this is something that you have to keep in mind how the examiner will try to give you question. So remember, yeah, a boy presented with vomiting. Okay, a boy presented with vomiting, jaundice, failure to thrive. Okay, as soon as breastfeeding was initiated. Breastfeeding was initiated. Breastfeeding में क्या होता है? Lactose होता है, and all the carbohydrates that we are consuming, beta, these are in the form of disaccharides only. Okay, so yes, नाउ ऑन एग्जामिनेशन, अगर एग्जामिनेशन किया तो हमें देखने को मिली हिपैटोमेगाली, हिपैटोमेगाली, राइट। एंड रिमेंबर यूरिन, Benedict's test. Now I want everyone to answer. Benedict's test is for what? Benedict's test is for what? You guys are going to answer me in the chat box. Urine Benedict's test was positive. Okay. Even they will be telling you the boy is using thick glasses. Okay, thick glasses, right? And yes, for this boy, basically what is happening? Yeah, lactose-free diet was initiated. Lactose-free diet was initiated for 4 to 5 years. Now, doctor recommended lactose-free diet was initiated until 4 to 5 years. But apart from that, now all the clinical features improved, but yes, the boy was seen with thick glasses. Can anyone tell me the reason why? Yes, yeah, blue color will appear, detect reducing sugar. Okay. Can anyone tell me the reason why? Beta, I've already told you infantile cataract will be there. Galactitol will accumulate in the eye lens. Galactitol will accumulate in the eye lens. So, is it clear, beta? Yes, is it clear, beta? Everyone? Chal, very good. Ash, very good. Yes. So, yes, yes, yes. Very good, beta. Now, beta, you already know कि गैलेक्टोज से गैलेक्टोज 1 फॉस्फेट बन रहा है, राइट? गैलेक्टोज 1 फॉस्फेट। फिर यूरिडाइल ट्रांसफरेज से वी आर गेटिंग ग्लूकोज, glucose 1 phosphate. Now uridyl transferase is absent. So what we are getting, galactose 1 phosphate. So this galactose 1 phosphate will convert into galactose. And you already know galactose is converting into galactitol. Galactitol. Okay. This galactitol, right? Galactitol. It is also called as dulcitol beta. It is also called as dulcitol. And yes, this will accumulate in the eye lens and it will cause oil drop cataract. So this is something that you have to mention beta over here. It causes oil dropped cataract. वो galactitol है, I suppose मैंने spelling तो नहीं गलत लिखी, हाँ galactitol ही है. So yes, I just forgot to mention one to you over here. Yeah. So yes, it will lead to a classical finding beta. It is galactitol. Galactitol, right? Now, what you will advise the mother as a doctor beta? I have a question to everyone. What you will advise the mother? What you will advise the mother? What should you give to the child? चलो इसका आंसर बताओ. मतलब चाइल्ड को क्या नहीं देना चाहिए? What you should not give to, what she should not give to her child? चलो इसका आंसर बताओ. Yes. बच्चे को क्या नहीं देना चाहिए भैया? ब्रेस्ट फीडिंग मना करोगे क्या? बोलोगे ब्रेस्ट फीड करते रहो बच्चे को? कौन सा मिल्क? ब्रेस्ट मिल्क बेटा. ब्रेस्ट मिल्क अलाउ करोगे या नहीं अलाउ करोगे? फीडिंग शुड बी व्हाट? यस, फ्री फीडिंग शुड बी एब्सोल्युटली कॉन्ट्राइंडिकेटेड. अगर तुम मुझसे पूछोगे ट्रीटमेंट क्या है इसका, तो लैक्टोज फ्री डाइट देना है पेशेंट को. लैक्टोज फ्री डाइट. यस ऐश, यस. लैक्टोज फ्री डाइट कहने का मतलब है ब्रेस्ट मिल्क. Breast milk, it is absolutely contraindicated. It is absolutely contraindicated. It is absolutely contraindicated. Okay. Yes. And it is like given lactose free diet, it is given approx for a year of 4 to 5 years. उसके बाद क्या होता है? What happens out after 4 to 5 years? After 4 to 5 years, beta, what will happen? Remember the galactose 1 phosphate pyrophosphorylase pyrophosphorylase becomes active and yes, इसका काम क्या होता है? अब ये जो गैलेक्टोज 1 फॉस्फेट है, ये गैलेक्टोज 1 फॉस्फेट जो है, ये गैलेक्टोज में कन्वर्ट हो सकता है विद द हेल्प ऑफ दिस एंजाइम. With the help of this enzyme, so it simply means that galactose 1 phosphate will be converted into galactose. ठीक है, with the help of this enzyme, and this enzyme only becomes active after 4 to 5 years. Yes, Varun, very good. And that is the reason we allow breast we don't allow breast milk. Okay, it is absolutely contraindicated up to 4 to 5 years, but after 4 to 5 years this galactose 1 phosphate beta, this galactose 1 phosphate will be converted to galactose. Okay, रिवर्स रिएक्शन में फॉस्फेट रिमूव करना है, तो अब मैंने पहले भी बताया था फॉस्फेट रिमूव करने के लिए फॉस्फोराइलेज एंजाइम यूज करेंगे. फॉस्फेट रिमूव करने के लिए वी विल यूज द phosphorylase enzyme. Okay, pyrophosphorylase. So galactose 1 phosphate will be converted to galactose. Okay, phosphate group remove हो गया, galactose will undergo reduction and it will form galactitol or dulcitol, or galactitol will appear in the eye lens. Okay, it will appear in the eye lens. Okay, causing cataract. Okay, बिल्कुल कुछ मतलब प्लेन कैटरैक्ट और बहुत ही मोटा मोटा ग्लासेस देखने को मिलेगा. ऐसे जो पेशेंट्स होते हैं ना, बहुत मोटे मोटे ग्लासेस लगा के रखते हैं. सो ये सारे कंडीशंस इंप्रूव हो जाएंगे, बट दैट इज समथिंग व्हिच विल नॉट इंप्रूव. इट इज दैट कैटरैक्ट दैट विल अपीयर. ओके, दैट विल स्लोली प्रोग्रेस. इज दिस क्लियर टू एवरीवन बेटा? इज दिस क्लियर टू एवरीवन? चलो, इज दिस क्लियर टू एवरीवन? चलो हर्ष, वेरी गुड, वेरी गुड बेटा. यस, चलो अभी आप स्टार्ट कर देते हैं फ्रक्टोज मेटाबॉलिज्म. फ्रक्टोज मेटाबॉलिज्म, और उसके बाद मैं कुछ क्लिनिकल केसेस कराऊंगा. आज क्लिनिकल केसेस भी करेंगे क्योंकि हम लोग हमेशा हर टॉपिक की बात करते हैं. तो यस, लेट्स स्टार्ट विद फ्रक्टोज मेटाबॉलिज्म एवरीवन. फ्रक्टोज मेटाबॉलिज्म, फ्रक्टोज मेटाबॉलिज्म, right? Yes, now fructose metabolism, you already know. We have fructose. Okay, we have fructose. Now this fructose will be getting converted to fructose 1 phosphate. Now you guys are going to tell me which enzyme will be used over here. You guys are going to tell me which enzyme will be used over here. फटाफट से आंसर दो इसका. Fructose will be getting converted to fructose 1 phosphate. इतना इजी है बेटा, अभी तो बताया. खुद देखो बेटा, फ्रक्टोज में कितने कार्बन है? यस जैनम, वेरी गुड, 6. इस फ्रक्टोज में कितने कार्बन है? 6. और पहले फ्रक्टोज पे फॉस्फेट लग गया. फॉस्फेट कहां से आएगा? फॉस्फेट आएगा एटीपी से. यस, काइनेज होगा ना बेटा, सब कुछ पढ़ाया हुआ है. यस, काइनेज. चिराग, रिया, वेरी गुड, काइनेज होगा बेटा, काइनेज. यस, इट इज काइनेज. अब तुम लोग कितने स्मार्ट हो गए और सब जगह एक ही चीज यूज कर रहे हैं. कॉमन सेंस, वेरी गुड. तो एटीपी एक मॉलिक्यूल है, एडिनोसिन ट्राइफॉस्फेट. It will convert into adenosine diphosphate. It will give 1 phosphate to fructose. ATP is 1 molecule. Fructose is 1 molecule. Okay. When phosphate is transferred from one molecule to another, from ATP to fructose, we use the enzyme kinase. And since it is fructose, it is fructokinase. It is fructokinase, right? It is fructokinase. And अब fructose 1 phosphate बन गया. Yes, fructose 1 phosphate बन गया, right? Now this fructose 1 phosphate, with the help of enzyme aldolase B, okay, with the help of enzyme aldolase B, will be now converted to, okay, will be now converted to glyceraldehyde. ग्लिसरैल्डिहाइड. अब मुझे फटाफट से बताओ ग्लिसरैल्डिहाइड में कितने कार्बन होते हैं? Just answer me in the chat box. What is the total number of carbon atoms in the glyceraldehyde? 3. Very good. और फिर क्या बन जाएगा? डाई हाइड्रोक्सी एसीटोन फॉस्फेट. Trihydroxyacetone phosphate. Yes, everyone is right. Chirag, Riya, Jainam, Usman. Very good, beta. Dihydroxyacetone phosphate. Glyceraldehyde and trihydroxyacetone phosphate. Glyceraldehyde 3 phosphate हो जाएगा ना? Glyceraldehyde 3 phosphate और डाइहाइड्रोक्सीएसीटोन फॉस्फेट. तो कुछ नहीं है, ग्लिसरल्डिहाइड में 3 कार्बन है, ठीक है, और डाइहाइड्रोक्सीएसीटोन फॉस्फेट में भी 3 कार्बन है. अब dihydroxyacetone phosphate can change into glyceraldehyde 3 phosphate. Tell me the name of the enzyme. Tell me the name of the enzyme. ये मैं सब पढ़ा चुका हूं. फटाफट से name of the enzyme बता दो क्या यूज होगा. फटाफट से name of the enzyme बता दो क्या यूज होगा. Isomerase. Very good, Harsh. It is isomerase. इतनी खुशी हो रही है मुझे जान के कि you guys are yes. Phospho triose isomerase. फॉस्फो क्यों? क्योंकि फॉस्फेट ग्रुप लगा हुआ है. ट्रायोस क्यों? क्योंकि 3 कार्बन है. और आइसोमरेज. तो अब ग्लिसरल्डिहाइड 3 फॉस्फेट के 2 कंपाउंड्स हो गए, 2 मॉलिक्यूल्स हो गए. राइट, वेरी गुड, एवरीवन इज राइट. जैनम, चिराग, रिया, उस्मान, ऐश, वेरी गुड. नाउ दिस ग्लिसरल्डिहाइड फॉस्फेट विल फॉर्म पाइरुवेट. यू ऑलरेडी नो कि वो आगे चल के क्या बनाएगा. सीरीज ऑफ रिएक्शन विल गो ऑन एंड इट विल फॉर्म पाइरुवेट. Pyruvate will enter into mitochondria. Okay, it will go into mitochondria and it will form acetyl coenzyme A. Acetyl coenzyme A. Acetyl coenzyme A can go into TCA cycle. Okay, it can also synthesize fatty acids. It can also synthesize fatty acids, triacylglycerol. So acetyl coenzyme has multiple fates. So that is about the fructose metabolism, guys. I think it is like very simple. It is like very simple. Yes, it is very simple. So I hope this is clear to each one of you. I hope this is clear to each one of you. Just give me a thumbs up, beta. I hope this is clear to each one of you. चलो, फ्रक्टोज मेटाबॉलिज्म समझ में आ गया. अब हमें पढ़ना है एंजाइम डेफिशिएंसी के बारे में. यहाँ पे आपको 2 एंजाइम्स के बारे में पढ़ना है बेटा. 2 एंजाइम्स के बारे में पढ़ना है. एक तो फ्रक्टोकाइनेज इफ इट इज डेफिशिएंट और एल्डोलेज बी इफ इट इज डेफिशिएंट. Okay, there are 2 conditions that will be resulting from the deficiency of these 2 enzymes. Let us try to tabulate the differences. Okay, let us try to tabulate the differences. So write down disorders of fructose metabolism. Disorders of fructose metabolism. Disorders of fructose metabolism. And remember beta, the first one, it is essential fructosuria. Okay, and the other one, it is hereditary fructose intolerance. Hereditary fructose intolerance. Okay, हाँ चलो, वेरी गुड चंद्रू, वेरी गुड. चलो एक एक पॉइंट पे डिस्कस करते हैं. जैसे हमने वहां पे टेबल बनाई थी, इसकी भी दोनों कंडीशंस हम लोग डिस्कस करेंगे. मैंने थंबनेल में एक ही दिया हुआ था बट थोड़ा ज्यादा पढ़ेंगे. एंजाइम डेफिशिएंट, essential fructosuria. The enzyme deficient over here will be fructokinase. Now you already know fructose, it is getting converted to fructose 1 phosphate. Enzyme, it is fructokinase. Now beta, it is deficient. Will this reaction take place? No. So there will be increased amount of what? Tell me in the chat box. There will be increased amount of what? Yes, fructose. Very good Jainam. Fructose का लेवल बढ़ जाएगा बॉडी में. fructose 1 phosphate में मेटाबोलाइज नहीं होगा. Right? Yes, everyone. Chandru, very good. Riya, Harsh, Chirag, very good beta. Hereditary fructose intolerance में beta, the enzyme which is deficient, it is aldolase B. Now you already know aldolase B, it is converting fructose 1-phosphate. Okay, it is converting fructose 1-phosphate into glyceraldehyde 3-phosphate and dihydroxyacetone phosphate. Now this enzyme is deficient, तो body में fructose 1-phosphate का level बढ़ जाएगा. Okay, fructose 1-phosphate का level बढ़ जाएगा, right? Now coming on to pathophysiology. Coming on to pathophysiology. Coming on to pathophysiology, you already know, yeah, fructose will be increased. Yeah, what will happen? There will be increased levels of fructose. Now this fructose, okay, it is not trapped into cells. Yes, okay, this increased fructose, it is not trapped into cells. Okay, it is not trapped into cells. What is happening beta over here? What is happening over here? It is not trapped into cells. Now this fructose, okay, yeah, this fructose, remember beta, this fructose will be okay, will convert into fructose 6 phosphate with the help of enzyme hexokinase. With the help of enzyme hexokinase. With the help of enzyme hexokinase. Okay, so yeah, yes. Is this clear as of now? Just tell me in the chat box. I'm looking at the chat box, but no one is replying. Is this clear to everyone? कि देखो फ्रक्टोज तो बढ़ जाएगा और फ्रक्टोज ट्रैप नहीं हो सकता, तो एक ही प्राइमरी पाथवे बचता है बेटा. ओके, वी हैव ओनली वन प्राइमरी पाथवे वेयर यू कैन सी the fructose getting converted to fructose 6 phosphate with the help of enzyme hexokinase. Okay, now over here what will happen beta? Yes, yes, this now this increased fructose 1 phosphate, okay, this increased fructose 1 phosphate, what it will do, it will inhibit, okay, it is allosteric inhibitor of glycogen phosphorylase. Glycogen phosphorylase. Now what will happen? There will be decreased glycogenolysis. There will be decreased glycogenolysis and the patient will be suffering from fasting hypoglycemia. Fasting hypoglycemia. Yes, fasting hypoglycemia. हाँ, ठीक है. Now guys, yes. What is the presentation over here? Presentation in essential fructosuria beta. Presentation in essential fructosuria. The patient, it is usually asymptomatic. Asymptomatic. Okay. It is benign condition. It is benign condition. Right. Fructose. Okay. Now fructose will be, yes. Yes. Very good. Fructose will appear in urine and blood. Yes, it will appear in urine and blood. So yes, if the fructose will appear in urine, what it is called as, and if the fructose appears in blood, what it will be called as? चलो फटाफट से बता दो इसका आंसर. हाँ चलो, एक तो ठीक है, फ्रक्टोस यूरिया ठीक है, और या ब्लड में अगर बढ़ जाएगा लेवल तो क्या बोलोगे? जल्दी से बताओ. जल्दी से बताओ. ब्लड को क्या बोलेंगे? ईमिया बोलते हैं ना. हाँ, फ्रक्टोसीमिया. ठीक है, ठीक है, ठीक है, ठीक है. रिया ठीक है बेटा, वेरी गुड, वेरी गुड. यस, चंद्रू वेरी गुड, उस्मान वेरी गुड बेटा. प्रेजेंटेशन की अगर बात की जाए, प्रेजेंटेशन की अगर यहाँ पे बात की जाए बेटा, रिमेंबर इट इज एज ऑफ ऑनसेट या क्लिनिकल फीचर्स अगर मैं बोलूँ तो एज ऑफ ऑनसेट बेटा इट इज अराउंड 6 months. Okay, it is around 6 months, right? Age of onset it is around 6 months. Okay, the patient will have vomiting. feeding difficulty, feeding difficulty, failure to thrive, failure to thrive. Okay, it can also lead to coma, liver failure, liver failure, hepatomegaly, hepato, yes, hepatomegaly, hepatomegaly, and again you will see jaundice, jaundice. Now, my question to everyone over here, if you have listened, if you like have listened to this lecture very carefully, you are going to tell me कि what is the main difference कि सर सारे clinical features तो आपने गैलेक्टोसीमिया वाले लिख दिए, सारे clinical features तो गैलेक्टोसीमिया वाले, तो हम differentiate कैसे करेंगे? What is the one difference that you will get in the question? चलो फटाफट से बताओ वो एक difference क्या है जो मैंने यहाँ पे mention नहीं किया है, जो मैंने यहाँ पे मेंशन नहीं किया, जल्दी से बताओ इसका आंसर। एज, एज दे ही नहीं रखी क्वेश्चन में। चलो नेक्स्ट चीज पे आ जाओ। एज से कोई नहीं है, इन्फेंट्स में ही है दोनों। इट एक्चुअली डिपेंड्स ऑन कि मदर कब लेकर आ रही है बच्चे को। या इंटेलेक्चुअल डिसेबिलिटी, एसएस कैसे करोगे पेशेंट में इंटेलेक्चुअल डिसेबिलिटी? 1 साल का बच्चा तो वैसे ही नहीं तुम्हें कुछ बोलेगा, तो थोड़ी कह दोगे कि तुम पागल हो। यस रिया सिंह, वेरी गुड बेटा। कैटरैक्ट, कैटरैक्ट, वेरी गुड, मजा आ गया बिल्कुल। ये आंसर चाहिए। ऊट जॉन्डिस तो बेटा मैंने लिखा है ना यहाँ पे, ऐश देखो जॉन्डिस तो मैंने लिखा है। मैंने वहां पे यही चीज तो बोली थी, गैलेक्टोज जो है वो कन्वर्ट हो रहा है, ठीक है, रिड्यूस हो रहा है गैलेक्टिटोल में, बट यहाँ पे फ्रक्टोज कन्वर्ट नहीं हो रहा। फ्रक्टोज इज कन्वर्टिंग टू फ्रक्टोज 6 फॉस्फेट, फ्रक्टोज 6 फॉस्फेट, वो रिड्यूस नहीं हो रहा है। यस, यस, कैटरैक्ट विल बी द आंसर बेटा। इसको मोटा मोटा लिख लो। डिफरेंस बिटवीन galactosemia, difference between galactosemia and hereditary fructose intolerance, it is cataract. Okay, it is cataract, cataract, galactosemia, cataract present, hereditary fructose intolerance, cataract absent, cataract absent. Yes, cataract absent, right? Now, now, what you will, yes, what is the diagnosis? Okay, now I will be discussing about hereditary fructose intolerance. Yes, hereditary fructose intolerance only, hereditary fructose intolerance. Okay, or let me just tabulate the differences only. Okay, जो हम लोग हेरिडिटरी फ्रक्टोज इंटॉलरेंस यहाँ पे था, ठीक है, और हमारा एसेंशियल फ्रक्टोसोरिया यहाँ पे था, ठीक है। चल, more differences. Now, what is the diagnosis, beta? What is the diagnosis? Yes. How will you see? Okay, you guys are going to tell me. Benedict test. Benedict's test will be positive or not? Benedict's test in both the cases, beta. Now you are going to tell me Benedict's test. Yes, it will be positive in both the cases, right? Benedict's test will be positive in both the cases, right? Now, there is something that you will see. Yeah. Yes. हाँ ठीक है, पॉजिटिव है, ठीक है उस्मान। हाँ, ओके, इट्स ओके। नाउ यू आर गोइंग टू टेल मी देयर इज समथिंग कॉल्ड एज, या, यूरिन डिपस्टिक टेस्ट, यूरिन डिपस्टिक टेस्ट। यस, Now urine dipstick test basically means the urine will contain reducing substances. The urine will contain reducing substances. So obviously बात है urine dipstick will be, yes, you guys tell me. Yes, it will be positive, right? It will be positive for here also, right? Now, yes, positive. Otherwise, you can also do enzyme studies in both the cases. Enzyme studies, okay? We can do genetic mutation studies also. Genetic mutation studies. And yes, what you will recommend the mother, beta? What you will recommend the mother? Which free diet should be there? हाँ, क्या लिखा है तुमने उस्मान? Urine dipstick, what we see. Okay, okay. Now you guys already know in urine dipstick what we will get, reducing sugar. Okay, reducing substances we will get. And you already know the reducing substances will be excreted in urine. That's why this test will become positive. Right? Yes, Chandru, very good. It is fructose free diet. बेटा lactose कहाँ से आ गया इसमें अब इसमें हम लोग ट्रीटमेंट बस कुछ नहीं देना है, इसको फ्रक्टोज फ्री डाइट देना है. फ्रक्टोज फ्री डाइट. फ्रक्टोज फ्री डाइट. ओके, कहने का मतलब है कि सुक्रोज कम देना है, बिकॉज सुक्रोज यू ऑलरेडी नो इट इज ग्लूकोज प्लस फ्रक्टोज. ओके, ग्लूकोज प्लस फ्रक्टोज, राइट. एंड ऑल्सो sorbitol भी नहीं बनना चाहिए, okay, because sorbitol is also metabolized to fructose. Okay, sorbitol, it is also metabolized to fructose, right? Now, चलो, इतना क्लियर है सब लोगों को? इतना क्लियर है सब लोगों को? इतना समझ में आ गया सब लोगों को? चलो एक क्वेश्चन करोगे, एक क्लिनिकल केस तू, एम्स में आया हुआ क्वेश्चन है. चलो हर्ष जयनाम, वेरी गुड. आश, वेरी गुड. चलो एक एम्स में आया हुआ क्वेश्चन है. लेट अस जस्ट ट्राई टू solve this question, and I want every one of you to answer this question. Let me see how many of you are able to answer this question. Question number 1. Now a patient has normal blood sugar, normal blood glucose level, okay, as estimated by glucose oxidase method. Now, after that, it has positive genetics test, positive genetics test in urine, right? Which of the following is the likely cause? Which of the following is likely cause? Now, you guys are going to answer me. It is fructosemia, galactosemia, diabetes mellitus, latent diabetes mellitus, or glucose intolerance. Sure. Option B, galactosemia. Why not fructosemia? Why not fructosemia, guys? Chalo beta. Answer is B. I don't know how you got it right, but yeah, I'm very happy that everyone is getting it right. Beta, galactosemia. See, fructose na, अगर fructose की बात करूं बेटा, it is having very low renal threshold. Okay, low renal threshold. Okay, so even if a patient has fructose kinase deficiency, what will happen? Fructose level will be increased in the blood. Okay, fructose level will be increased in the blood, but after some time the blood fructose beta, the level will not rise, okay, because the renal threshold for fructose, it is low, okay, means there is no fructosemia, there is fructose urea, okay, there is fructose urea. So yes beta, yeah, so that is, it is galactosemia only. That is, it is galactosemia only that you have to remember. Yes, apart from that, beta. Yes. Okay. Now next question. One more question that you are going to answer. Yes. Now, a newborn baby refuses breast milk. Okay. A newborn baby, basically it refuses breast milk since the second day of birth. Since the second day of birth. Right? Now, vomits on force feeding. Okay. Now, develops diarrhea. Develops diarrhea on third day. Okay. Fifth day, jaundice. Fifth day, jaundice. Yes, fifth day, jaundice. And liver enlargement. Liver enlargement. And eyes shows cataract. Eyes shows cataract. Okay. Urinary reducing sugar has positive blood glucose. Okay. Urinary reducing sugar. Okay. Urinary reducing sugar has positive, was positive. Okay. But okay, but blood glucose, which was no estimated by glucose oxidation method, it was low. Okay, the most likely, now coming to the question, the most likely cause is deficiency of, this is an AIMS question beta, this is an AIMS question, AIMS 2003, I think, I don't know when it was asked, I have no idea as of now, but it is, yeah, one of the years NICT exam. Galactose 1 phosphate uridyl transferase, uridyl transferase. B, beta galactosidase, glucose 6 phosphate, and D, galactokinase. चलो बताओ आंसर इसका जल्दी से. Everyone, try to answer this question, everyone. Yes. Harsh, very good beta. Galactose 1 phosphate uridyl transferase. Very good Chirag, very good Riya, very good Jainam, very good Ash. वेरी गुड बेटा. ऑब्वियसली बात है, अब खुद देखो क्वेश्चन तुम्हें खुद ही हिंट दे रहा है कैसे क्लिनिकल केसेस आते हैं. देखो मैं सब तुम्हें बता दिया. न्यू बॉर्न बेबी, ठीक है, ब्रेस्ट मिल्क दिया गया. ब्रेस्ट मिल्क कहने का मतलब है लैक्टोज दिया गया उसको. सेकेंड डे ऑफ बर्थ. ओके. वॉमिटिंग हो रही है, डायरिया है, जॉन्डिस है, हिपैटोमेगैली है, और आईज में कैटरैक्ट देखने को मिल रहा है. सी द फीचर इज ओनली लिमिटेड टू नो द गैलेक्टोसीमिया. एंड यस, you already know it is galactose 1 phosphate uridyl transferase which will be deficient. देखो है clinical question. Okay, now you understood guys. See, this is biochemistry. The question is clinical. You have to diagnose the disease. Okay, agreed. But ultimately what they are asking beta in the options, it is the enzyme deficiency, and that is something which you already know. That is about this yeah, galactosemia only. Galactosemia only, right? Galactosemia only. हम्म. चलो एक क्वेश्चन और करके बताओ. ये थोड़ा सा इजी क्वेश्चन है. ये जिपमर में क्वेश्चन आया था एक जिपमर वाला क्वेश्चन भी बता दो. चलो. Yes, you are going to tell me this question. Hereditary. Hereditary fructose intolerance. Hereditary fructose intolerance is due to deficiency of. It is due to deficiency of. Okay. Aldolase A, aldolase B, fructokinase, and yes, okay, sucrase. चलो चलो वेरी गुड। चिराग ने पहले ही आंसर कर दिया, मेरे लिखने से पहले ही आंसर कर देते हो यार तुम लोग ना। चिराग ललवानी, वेरी गुड। ये तो गलत बात है, ठीक है। हर्ष वेरी गुड, रिया वेरी गुड। अगली बार मैं प्रिंटेड रखूंगा क्वेश्चंस, ठीक है। यस इट इज बी, बी बी। उस्मान जयनाम वेरी गुड। ये बताओ, पीजी एग्जाम में क्वेश्चन आया था, देखो कितने इजीली मेरे स्टूडेंट्स ये आंसर कर पा रहे हैं। इट इज एल्डोलेस बी। एल्डोलेस ए डेफिशिएंसी बेटा ग्लाइकोलाइसिस में देखने को मिलेगी, ठीक है, ग्लाइकोलाइसिस में, राइट। हाँ चलो, इतना क्लियर हो गया सब लोगों को, इतना क्लियर हो गया। यस हम्म। एक चीज मैं और बताना भूल गया बेटा, ई कोलाई सेप्सिस देखने को मिलता है इसमें, क्या कहते हैं या जस्ट मेंशन इट ओवर हियर। क्लासिकल गैलेक्टोसीमिया में ना यू कैन जस्ट मेंशन, ये एक इंफेक्शन देखने को मिलेगा या yes just mention it over here beta, it is can predispose to neonatal sepsis, okay, or neonatal sepsis, or yes it is the E. coli, okay, E. coli, yes, classical galactosemia, it can predispose neonates to E. coli sepsis, right। एनाटॉमी की क्लास बेटा कल ले लेते, कल मॉर्निंग में बता दो, कल कर लेते एनाटॉमी की क्लास, कोई दिक्कत नहीं है। मॉर्निंग नहीं, इवनिंग में कल। फीमर, सॉरी मैंने फीमर करा दी है तुम लोग को, टिबिया करा दिया है, हिप बोन करा दिया है। टुमारो आई कैन डू या पटेला एंड यस, पटेला एंड फिबुला कर लेते हैं कल। पटेला, फिबुला और जितनी भी टार्सल बोन्स हैं कल कर लेते हैं, ठीक है। बिल्कुल घबराने की बात नहीं, वो सारे चीजें हम लोग कर ही लेंगे, ऑब्वियसली नो नीड टू वरी अबाउट दैट। एक चीज और मुझे जो डिस्कस करनी है, दैट इज अबाउट द सॉर्बिटॉल। एक बार सॉर्बिटॉल के बारे में भी थोड़ा सा डिस्कस कर लेते हैं, ठीक है। सॉर्बिटॉल, नाउ सॉर्बिटॉल बेसिकली बेटा क्या है। फॉर एग्जांपल यू ऑलरेडी नो वी हैव ग्लूकोज, ओके, ग्लूकोज। ग्लूकोज को जब भी रिड्यूस किया जाता है तो वो क्या बनाता है, एल्कोहल, ये कंसेप्ट है। ग्लूकोज को जब भी रिड्यूस किया जाता है तो वो क्या बनाता है, एल्कोहल। बेटा जनरल एनाट मैंने नहीं कराया, शायद जनरल एनाट किसी और टीचर ने पढ़ाया हुआ है, तो यू कैन गो थ्रू द वीडियोस इफ इट्स लाइक मेंशन्ड ओवर हियर, राइट। मतलब यहाँ नहीं मेंशन, मतलब लाइव सेक्शंस में जाके चेक कर सकते हो, नो आइडिया। Glucose will be converted to sorbitol. Okay, it will be converted to sorbitol with the help of enzyme aldose reductase. Okay, with the help of enzyme aldose reductase. Right now, this sorbitol beta, this sorbitol can also convert into fructose. Okay, it is by the help of enzyme sorbitol dehydrogenase. Sorbitol dehydrogenase, and it can also convert into, yes, it is the sorbitol pathway. It is, yes, it is about this beta. Okay, now another method to trap glucose in the cell, basically it is to convert to its alcohol counterpart. तो अगर ग्लूकोज को सेल के अंदर पूरा ट्रैप करके बंदी बना के रखना है तो क्या कर सकते हैं, एक मेथड ये भी कि उसके रिड्यूसिंग जो एल्कोहल बनाने वाला पार्ट ना, ग्लूकोज को रिड्यूस करा के, या ग्लूकोज को रिड्यूस करा के हम लोग रख सकते हैं। ओके, एंड वाई एंजाइम यू ऑलरेडी नो, इट इज द एल्डोस रिडक्टेस, एल्डोस रिडक्टेस। ओके, some tissues then convert sorbitol to fructose using sorbitol dehydrogenase. Okay, अब मेरा क्वेश्चन आप लोगों से ये है कि अगर sorbitol dehydrogenase deficient है, will sorbitol be able to convert into fructose? Will sorbitol be able to convert into fructose? No, obviously not, नहीं होगा ना, obviously नहीं होगा। You already know if this enzyme is deficient in many of the places in our body. Okay, now what it will lead to, if this is deficient, what it will lead to, yes, yes, no, 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 very good रिया चिराग चे नाम से उसमें obviously बात है, उसमें convert नहीं होगा, basic sense ही बोल रही है। तो what will happen, sorbitol accumulation will take place, sorbitol accumulation will takes place. Okay, it will cause osmotic damage, and that is why it will lead to cataract. Okay, damage to the retina layer, retinopathy. Okay, so yes, that is you have to remember, beta. Okay, that is you have to remember. So now, is this clear to everyone? Is this clear to everyone? Apart from that, beta, apart from that, I have already told you the galactose. It is converting into galactitol with the help of enzyme aldose reductase. Okay, aldose reductase. Galactose is converting into galactitol or dulcitol, right? Yes. Oil drop cataract. So you already know. Yes. चलो इतना क्लियर है सब लोगों को एल्डोस रिडक्टेस basically beta it is seen this enzyme it is seen in yeah retina kidneys lens right Schwann cells. So yes, these are primarily seen over here. These are primarily seen over here. So that was regarding the sorbitol pathway also. I have discussed about the fructose metabolism and the differences between the essential fructosuria and hereditary fructose intolerance. I have discussed about the galactokinase and the classical galactosemia differences, galactose metabolism. Okay, I hope today's lecture is clear to each one of you. I hope that today's lecture it is clear to each one of you, beta. So just give me a thumbs up in the chat box if it's done for today. Chaliye.